Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. We are about to commence our first conversation for the morning. Marlene, it's a two-part segment. And joining us in the virtual space is Dr. Lisa Johnson. Good morning, Doc.
Good morning to you both.
She is a general and trauma surgeon as well as the Dean of Faculty of Health Sciences at the University of Belize. Our conversation with her this morning is going to be around the development of the health sector in Belize in the context of COVID-19. Good morning once again, Dr. Johnson.
Good morning, and thank you for having me.
Where do you want us to begin from? Because when we look at the health sector, we're looking at a very robust and important area of the overall landscape that ensures that Belizeans and their well-being remains either safe or well put together. Where do you want us to begin from?
Well, when you look at the health sector, I'm a structure person, so you must look at the structure first.
Yeah.
Health, and some would say wellness as well, has two main fronts of attack as it relates to public health, the health of the individual within a society. So there are those areas and those specialties that deal with primary health care, the public health, health education, and the health of the society on a whole. So that would include your public health specialist, your public health nurse, your public health inspector, your vector control, those who maintain potable water, those professions, as well as the epidemiologists, those who track disease, and of course those who educate, those who break things down so that everyone can understand what is in their best interest, what is to happen. So that in itself is one particular structure. The other structure then is hospital medicine, which is a different animal, and the levels of hospital medicine, secondary care, tertiary care, and quaternary care. Now, if you want to say that you would want to be robust in your public health prevention and education so that there is less strain on the secondary, tertiary, and quaternary, there will always be diseases that we have to deal with. But if you keep your society healthy, then the strain on the other part it will diminish, of course, but it doesn't mean you don't have to have them, and it doesn't mean that you do not ensure that they are of the highest standard and quality. Yeah. So in terms of development, both arms need to be developed in tandem with each other, but the underlying principles of both differ to some extent.
So when you look at Belize's response to COVID-19, and I really appreciate your differentiation between when we talk about healthcare, just from public health right up to some of the most specialized care that we may or may not be able to offer. But our COVID-19 response, I think what was most visible to the public was looking at the public health aspect. But it was also very crucial that kind of behind the scenes, we're strengthening or reinforcing the other aspects of healthcare. How do you think we fared off?
We have done reasonably well. We have, I think, and I would hope learn from any early missteps um, that may have occurred. I think that we started off on the footing that people would be responsible and follow strong suggestions, and that the public and those who came into contact would act appropriately. And I think, unfortunately, human nature just does not take us to that realm. And so I think it became clear that people have to be managed in a certain way. Once they've been identified as potential, at risk or exposed, then the rules need to kick in and the rules need to be enforced. And I think that may have been a bit of a learning curve. But I would hope now that we are repatriating citizens, that those rules, in most situations in this country, the rules exist, just don't enforce them. So I'm hoping that is the major difference that occurs now.
Yeah.
When the hospital system was accessed, certainly there are things, if one takes into consideration what relatives have put out and what others have put out, one would want to hope that whatever issues arose there have been corrected.
Yeah.
But I will say this, the pandemic is not this place where your best can come out if you had not put your best in from the start. So you've got to be at a certain standard, and you've got to be following certain principles, because when the pandemic comes in, that it shows up all the things that ought to have been addressed that will not be addressed, and the longer that the pandemic sits on as a specter over the entire world, the more likely it is that more gaps will come to the fore.
That's a sharp point that you've raised there in terms of, if we look in the Belizean context, for instance, one could argue that our healthcare system, in a manner of speaking, has not really been tested based on the fact that we were able to mitigate and keep our outbreak down to only 18 persons. How would you respond to that?
That is, I think every COVID patient is a test.
Okay.
So it has not been overwhelmed, which is the whole point of the public health structure and initiative, is to not have your system tested. But in a situation like this, every patient that accesses the system, whether it is the public health system and the epidemiologists and the disease trackers, or it's the hospital system and the doctors and nurses on the front line, every time there's contact, there is a test.
Yeah.
The thing is one must understand that it's a test, and one must seek to learn from the test.
You know, I think one of the things that we saw globally was, and I think it perpetuated quite a bit of fear in people across the globe, when we saw what are considered some of the world's best healthcare systems just struggle in being able to offer adequate care to COVID-19 patients. You know, we see in the United States, which is where we get most of our news from, but we were also seeing stories coming out of Europe and other parts of the world. We didn't necessarily have that test, and I still go back to what we said before. The public health efforts was kind of like the first barrier to prevent us from getting to that space. But you said something so important, and I think it's that the pandemic won't just allow us to kind of be up to par. We won't be able to just rapidly equip and train people to offer that type of intense care that will be necessary. So in a sense, what has happened is it only highlighted a challenge that we have always had, which is that our tertiary care, or only public health tertiary care institution, has just not been able to improve over the years, and in fact has been lacking in many areas.
Well, my time there as Director of Medical Services, we spent a great deal of time training. Training in quantity and in quality. Levels of training that we had not, that I don't know if the Carlisle had seen before. And there was also a great push to get doctors and nurses, whoever could get out to do further training. Dr. Koya and myself concentrated on trying to get people out to do further studies. The building of capacity is very important. The capacity not only of the infrastructure and equipment, but also of the brain power and the brain trust, so to speak. And so the time that I spent there was about improving standards. It was about training and training and training and training.
And from your knowledge, having worked in the institution, had we had the overwhelming number of cases, and at this point, I think we often think that the big numbers would overwhelm us, but it would take very little to be able to overwhelm our healthcare system based on our capacity.
Yes.
And just from what you know, would we have been, how do you think we would have fared off?
I will tell you that the doctors and nurses would have done everything that they could, but they would have been limited by the amount of beds, the physical beds that you have that are present, and the number of other equipment that would be needed to maintain patients. You see, what people don't necessarily know, for example, is that every hospital worth their salt, first of all, will have a mass casualty policy. A detailed document that instructs the administration, the doctors and nurses in the front line on how to deal with a surge, overwhelming capacity. But one has to understand that the pandemic and how it has fared out in other countries is a mass casualty times a million. So when we have a mass casualty, for example, I can recall that influx of 50, maybe 20 patients, there are lots of things that have to happen that the hospital has to do and is instructed to do when we call a mass casualty. Everyone has to, all the relevant specialists have to come in. If there are additional nurses that can be moved to the accident and emergency, that is done. Other things slow down. All elective and non-emergent services have to stop to allow for the surge to be dealt with. But what this pandemic has shown us is that it is an overwhelming, continuous flow of very ill patients. So there's actually no health system designed or in the world that has the capacity to deal with that if public health measures and the safety measures aren't put in place. None in the world.
So what would be the primary takeaway here for our experience in terms of trying to now develop a system that works? I know that perhaps between now and when a second wave, if there's any, comes around, what can we put in place to address that in the short term? And what can we put in place to address the overall state of the health system going forward?
Well, the first thing, because at the tail end of it is the surge. So the education of people and for people to have the understanding that if we are passive participants in maintaining our health and wellness, then don't be surprised if the system cannot take the load. If you don't look after yourself and you don't participate in the community and in the society initiatives to protect itself, what is at the end, no one can prepare for in that sense. Having the things of having the PPEs, making sure that people remain ready to deal with it, ensuring that what we can do well. That should be that's an ongoing situation with adding the PPEs to the situation to the package that should already exist, and so it's ensuring that package remains ready and aware. But it will take the entire country, the entire population, to understand the role they play.
So in other words, and what I hear from you, and I think it's critical to say, we don't want to get to the point where you're going to test the mettle of the healthcare system in terms of very advanced care. We need to do our part to not allow that to happen. But even so, in the worst case scenario, I'd imagine, not the worst case scenario, in this time between what we keep on hearing, which is there is going to be a second wave, it is highly probable that we will have a second wave of patients. It's important to kind of get your house in order. You had that first test.
Yes.
We had 3 hospitalizations here in Belize City. We had 1 in Corozal. My numbers may be off, but that's what I can recall at this point. We had 2 fatalities. I really want to bring out a point that one physician pointed out to me, that in fact in the hospitalized cases, we had no frontline workers exposed. Because often when we criticize the healthcare system, I think people who work there feel that they're being criticized. But clearly they did what they were supposed to do, and none of our frontline workers became infected with COVID-19.
Yes. They were exposed.
They were exposed.
But there was no documented transmission to healthcare workers. So which is excellent under the circumstances, and lucky in some respects.
Absolutely. And I use that point to say, because you said it before, you said the doctors and the nurses in any one of our healthcare institutions are going to do their absolute best with whatever they have to offer the best care that they can. And so it shows that even though we don't have a regular custom of using PPEs or dealing with this level of infectious disease, that they still did the best that they could. And even though they were exposed, we didn't document any infection. But it is a time where perhaps we can look back at even the 3-4 hospitalizations that took place and assess where we're going to need to strengthen and where we'll need to enhance protocols that were quickly drawn up, because it is a pandemic that for the most part caught us off guard, and get everything in order for what lies in the future. What do you think?
Yes, we've entered. Sorry.
No, go ahead.
Yes, we have been in a lull is it the eye of the storm? And yes, this is an opportunity. I would suggest to my colleagues in those hospitals that they tease and dissect all their interactions with COVID-19 patients to understand where better can be done. I am not saying that the best was not done, but we must always seek. Modern medicine is about always seeking to understand what has happened, whether or not it went well. Those experiences should be dissected so that for the hospital practitioners, doctors and nurses and allied health professionals, so that you understand what can be done better, what can be done more efficiently, what can be done more effectively. That would be my advice to them.
In essence, we're saying that there's always room for improvement, correct?
Always, always.
You know, and us as the non-medical public, and I think because of the reports we were seeing in other parts of the world, we were very focused on how many ventilators and how many PPEs were accessible. But what are some of the other tools, training, or necessary equipment that, from your medical perspective, you think that we need to be paying keen attention to assess our level of preparedness?
Well, it's very important that each institution understands and has laid out clearly for its staff how potential patients should be handled. What is the flow of the patient within their institution once the patient makes contact. So if the patient comes in and is a suspected COVID case, where do they go? What should the staff do to properly manage this patient? And it can't be that the staff are not made aware and have access to the basics, which would be, of course, the PPE. But each institution has to have it clear and train into their staff what are the steps that are to be taken when their institution comes in contact with a patient. And that can be practiced. You can do stipulations, you can do further training, because as we speak, there's more and more information coming out about the disease. Yeah. Much more about the wide variety of pathology that can occur. So that information needs to be passed on to our frontline practitioners in a manner that they can absorb, and so that it continues to maintain and build awareness. Yeah. So those are some of the things that need to continue to happen. Yeah. It's a matter of being honest with yourself as administrators and people who manage frontline health professionals. Yeah. That there are always activities that are geared towards preparing their staff. Yeah, yeah. All right, well, what we're going to do right now, Dr. Johnson, is take a very quick break. There's quite a bit more that we want to discuss with you, but we will be back in just a few and continue that conversation.
When someone you love becomes a memory, the memory becomes a treasure. Channel 5 introduces the Daily Obituaries. The Daily Obituaries will broadcast all death and funeral announcements and memorials to honor your loved one's life and memories. The Daily Obituaries airs on Channel 5 prior to the evening newscast, with subsequent repeats at 10 p.m. and 12 noon the following day. It will also be placed online on our social media platforms, all for a standard package fee. Celebrate their lives and memories with Channel 5's daily obituaries. Honor in life and reverence in death.
And we're back, and we are continuing our conversation with Dr. Lisa Johnson, who is a general and trauma surgeon and also the Dean of the Faculty of Health Science at the University of Belize. Dr. Johnson, we just started to scratch the surface or look at the healthcare system and just the things that we now see having faced or being in the midst of a pandemic. Let me bring your professional capacity into this at this moment. In fact, you were just named the Dean of the newly formed Faculty of Health Science. I think it was last year, right? Just a few months
January.
ago. It was okay. It feels like a year since January. But nonetheless, it was a very critical role that was being established in our national university. And I know you had a lot of plans in place. Tell me now what happens since even the education system has had to quickly reform.
Well, over a year ago, the university and its board of trustees made two decisions. One, they wanted to open a medical school, and two, when they looked at their organizational structure, they wanted it to be a part of what they had already established in the Faculty of Nursing, Social Work, and Allied Health. And so they were going to put all the healthcare professions in one faculty, each their individual programs, and so created the Faculty of Health Sciences. And then went about doing some of the things that they needed to do. They formed the partnership with UNAD and in Nicaragua, and then they sought to find dean. I was recruited, and so we had been in the preparation stages to get the medical going, but there are certain principles that needed to be followed and needed to be strengthened. And given that we already have a very long history of training nurses, pharmacists, medical laboratory professionals, it was very important, in my view, that those programs get the absolute opportunity to strengthen themselves, because when the medical school starts, it will be pulling from a healthy structure.
Yeah.
So what the pandemic has done, it has caused us to move a significant amount of theoretical content into the online space. And I would have been one of the last people I would have expected to now understand understand now clearly that this space can be very useful to us.
Yeah. So, of course, the migration to online learning is the first change that has to be made. But given the context, is the university looking at perhaps being playing a part in being able to offer maybe continued professional development in perhaps some courses that will be relevant to addressing the pandemic, whether it's looking at emergency care or understanding more about COVID? There's so many courses online now to be able to offer this.
Well, you're talking about the training of specialized training,
yes.
More specialized training.
Yes.
And we are not there yet.
Mm-hmm.
when you look at continued training for healthcare professionals, it's not everyone and anyone that is equipped to do that. We learned a lot of lessons. For example, when we were doing it at Kushner, it required partnerships with institutions of some heft. And so for us right now, what we are trying to do at University of Belize is to make sure that the programs that give you those certified professionals are at their best. That is the commitment of the Faculty of Health Science. Yeah. That we continue to produce nurses, pharmacists, medical lab professionals, and social workers of the highest quality with the appropriate package of knowledge and skill. When it comes to the further education of these professionals, then those are add-ons. So, for example, there are the faculty has run on an ad hoc basis nurse anesthetist program, midwifery programs, and at this time, a degree in public health nursing. It's a program that's currently being worked on by senior people in the Department of Nursing. So from that point of view, the question becomes how do we pivot for COVID? I think more than ever, COVID shows us that we need to be training our own doctors. We will always be in the situation of benefiting from the kindnesses of other countries. Yeah. And if travel gets cut off in more serious ways than it already has, then the countries, and I'm talking specifically Cuba, who has been holding our hands for 30 years, we have to understand and go back to the old principle. If somebody's helping you, then you need to be preparing to not need that help.
Yeah.
Well, then the question...
Or, I don't see things any other way. We need to be getting ourselves into the situation where the help evolves.
Well, the question then becomes, what have we really been doing? If you're saying that for the past 30 or so years, Cuba has been by our side, what essentially have we been doing to be able to stand on our own 2 feet? When you look at the situation as it is, we are grateful that Cuba was able to immediately dispatch its medical brigade to Belize, but as a country, were this not to have been available to us, what would we have been doing to be able to lead the charge on our own becomes the question, correct?
Absolutely. The alliance and the relationship between the health sectors of Belize and Cuba goes back to the late 80s. I think the first meeting that took place, my mother was a part of it because she was the principal nursing officer of Belize at the time. And so, yes, this thing runs in my blood. And so, we continue to rely on a country that continues to be most helpful to us. And what we need to do is to figure out, okay, they continue to get nurses, we continue to get specialists. So we need to train more nurses and keep them here. So, will look at the point of how do we make sure our program meets regional accreditation and then ramping up that training so that we are putting out more nurses, but then you have to make sure the program is at the point where you want it to be, or headed in the direction that you want it to head. And then the launch of a medical school will become part of Belize getting itself ready to evolve in its relationship with Cuba as it relates to the health sector.
Yeah, yeah. You know, you said something, and I wanted to pick up on it because I think you know very well, having worked outside of Belize, that oftentimes people do go and get specialized training, whether it's as a physician or even as a nurse. And you have quite a number of students right here who graduate from the nursing school, but simply put, the opportunities outside of the country are far more alluring, or the conditions that they'd be asked to work in locally leave a lot to be desired. And so even if we have a medical school or a strengthened nursing school, will we be able to keep the people that we've built the capacity in?
Well, that is up to us as a country. It is very much, do the people of this country want quality health care? And how do you think you're going to get it? And how do you think you will keep your trained people or encourage your trained people to come home? It is the people here, living here every single day, going about their business. They're the ones who are going to determine how this thing comes out. Mm-hmm. Because if you have a system and a structure that does not encourage people to stay, that does not recognize the work that they are doing, that has decisions made by unqualified, unenlightened people, mm-hmm. that then affect how they do their job. One of the things that I maintain, that I find it difficult to listen to someone who has not had to be responsible for whether a person lives or dies. Mm-hmm. So your input into how I do things has a certain level. And if that's how we want, as a country, we want decisions to be made, then you get the results that you ask for. So it is about what you tolerate.
Mm-hmm. That is very interesting, and I think, I think the core of the matter as well is what this COVID-19 pandemic has done is just shown us where or lack of investment in the healthcare system has actually been to our detriment. Or monies are funneled in other sectors that are seen to be more lucrative, but it was left to be lagged. The health system was left to lag behind so far that we have a lot of catch up to do. And the complaints, I think, are interesting. We hear from the BMDA, the National Association of the Nurses Association of Belize, and the KHMH Workers Union. And a lot of it was very similar. It was about resources. It was about being able to feel that they had what they needed to work with. And what you said just now about whether or not we'll be able to retain people who are trained, it goes right back to the same as in investing in the healthcare system. It's also recognizing what you're willing to offer people to be able to stay in the system. Would you agree?
Yes, and it's not always about money.
No.
In fact, most of the time, it is not about money. It is about respect for the work, respect for the knowledge respect for the certifications and the training, and understanding that that certain decisions need to be made by those who are trained to make them, and that there is great value in building capacity. Sometimes, in countries like ours, training is doled out as a particularly foreign training, as some sort of gift. It's not a gift; it's a necessity, and the best people should offer the best opportunity. The best trained people, the best working people, should be offered the opportunity for improvement so that they can improve home.
Part of that too is the fact that we often view training as a one-off thing. We don't insist on continuous professional development, if I may. Whereas you continue to train to make sure that you're on top of all the changes within that particular field or sector.
Yes, and medicine is so vast. I qualified in 1994. And I'm happy now that I'm not a general practitioner, that I'm a general and trauma surgeon, because general practitioner has to have the length and breadth of medicine just continues to expand. And so the length and breadth of general surgery and trauma surgery is expanding. And so I can concentrate on those two particular areas. But for the person who has to have a multi-dimensional practice, if you're practicing how you should, you're supposed to be reading every day, practically.
You should have your nose in a book most of the time. I mean, and it's given what they can handle too. Because if you look at the workload, especially at the primary care level, sometimes there's a lot of people to see and a lot of paperwork to fill out. The time for the books may not exist either. But
that's why it has to be built into the work. The work must allow for, because in situations you're in a clinic, you have to get through a number of patients, but your employment should also include the space and the time to improve yourself.
And that's what you mean when you say being able to acknowledge the needs of people within the system. And I'm glad you said that, because I think automatically people assume that when we say resources, we think money. And that's not to say that it has to be an offer that will allow people to stay here. We see it all the time with our nurses. And I've talked to students coming out of UB whose exit plan is basically, when I graduate, I have these 3 countries I can possibly move and work to. Those are the options they have on their table. But let me bring
and it will get further by the countries that have lost healthcare workers during this pandemic. They're going to be combing the world for seasoned professionals, and ours will be snapped up.
And let me bring it back to the current situation at this time, because I don't want us to close without kind of getting just your perspective on this particular point. We hear very often the health experts internationally talk about how COVID-19 is here to stay. We've been living the past 2 months in just a completely different world. And when you hear that this disease, this perpetrator of uprooting everything we know is not going to go away, just from a science perspective, how do you explain that to people? If your loved one said, what do you mean we're going to live like this forever? How do you explain that?
No, we won't live like this forever. Humanity will adjust. So, to find that out, to understand that, all you have to do is look at history. You look at the Black Death and the bubonic plague. killed millions of people. Documented first appeared in the 1300s and went right up until the early 1900s. And what was the best thing that happened is that it did occur, it did show its face again in the late 1900s and early 1900s when medicine and science were then able to understand the causative agent and then act to prevent. So we have to understand that if there's a vaccine available next year, that will be, as Bill Gates says, the fastest time in human history when such a disease, such an agent was identified and a vaccine developed in such a short period of time.
You're saying 1 year is short?
Yes, it is.
In this case, necessity is the mother of invention. So
necessity is the mother of invention, and so everybody who can work on a vaccine is working on a COVID-19 vaccine. What shape that vaccine will take? Is it going to be the type of vaccine that gives long-term protection, or is it going to be a vaccine that you have to take every year or every 6 months? We don't know. We won't know until the data comes in. But humanity will adjust. Yes, we may lose. People will start to worry about the time that we are losing, but you have to understand what we are fighting as a species. It's an attack on an entire species, us as human beings. And so I'm trying to say to people, as bad as it has been, it can be worse. And we will have to find ways to get our economies to work. We won't be able to sit on our hands for too much longer. The key thing will be to approach it scientifically and to have your best minds working on possible solutions. And we are going to have to follow rules.
I was going to say, and we have to keep up our part of the work as well.
Yes.
And that's where I find that, public health is hard in itself. It's behavior change. We're not so good at changing our own behavior when we want. Things like washing your hands and social distancing and cleaning, shared spaces, disinfecting. These are all things that are required of us and that we do have to maintain. And the masks as well if you're going to be around people.
The same respect when we go to other countries, same respect that we show for their laws and structures, we need to show for our laws and structures.
All right. Any closing thoughts?
Just that we will all have to be and continue to be open-minded in that we may be flooded with theories, suggestions, and so on. We have to be open-minded, yet we also have to make sure that we don't hang on to the wrong information.
All right, Dr. Johnson, thank you so much for joining us for this conversation this morning.
You're most welcome.
All right, do take care and stay safe.
You too.
We're going to go ahead now and take a break. And when we come back, we're going to be talking about some of the training opportunities available at BTEC. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.